San Francisco officials' new measure to curb drug overdose deaths meets with a strong challenge.
CDC revised its data on Omicron big way.
Vaccine mandate for domestic air travel is touted, but nobody seems to have a clear answer.
A doctor got canceled by Twitter today, and we know exactly why.
Welcome to Wei and Kathy Show. I'm your host, Wei Fang.
And I'm Kathy Zhang.
Okay, so we have several pieces news for you. And today, the later part of the show will be still happening on the Safe Chat, and for good reason, which we'll explain a bit later. Okay, so but before we start, if you can, please press the like and making sure you are still stay subscribed, and also click on that the notification bell. All right, so let's continue on with today's first piece of news, Kathy.
Okay, right. So we all know that in San Francisco, ending this year and looking forward to the new year. In San Francisco, a lot of problems, but in addition to the recent smash and the grab robbery and the crime spike, San Francisco and even California could have are having more things to deal with, and one of them is the rising death from drug overdose. However, the California state legislature is pushing a bill aiming to solve the problem. But some law enforcement and faith groups severely opposed, citing the experiences from Canada and Europe. So what is that? It was so-called the safe injection site. I don't know if everybody have heard about it. So in California, there is a Senate bill called 57. Is created aiming to resolve the drug overdose problem. So what it has is including providing a place to inject drugs while trained staff are available to help if they suffer accidental overdose. And it was passed earlier this year in the California Senate. It was supposed to go on to the Assembly Health Committee, but then it was pulled. So the supporters of the bill was not happy, but they are looking at for the bill to be heard in the Assembly actually early January. So what is this bill's author is Senator Scott Wiener, who is from San Francisco, a Democrat from San Francisco. And so he has authored overdose prevention program in the city and county of San Francisco, Los Angeles, and the city of Oakland. So he said that these programs would provide a space supervised by trained staff, where people who use drug can consume pre-obtained drugs. Okay, and there will be trained nurse to give them the shots. So, but when it passed the Senate, it's very controversial especially among the Republicans. But anyhow, it was passed. So, what this so-called the safe injection site really solve the problem, and what does the experience from Canada and Europe tells us? So today, there's a group of opposers of this bill actually had a press conference. And so because why they are doing it right now, according to Scott Wiener, the senator who sponsored the bill, it will be heard by the Assembly in January. So people are very concerned. And so among them, actually, most of them are from the law enforcement community. And one of them is Ron Brooks. He's the executive director of a National Narcotic Officers Association Coalition. And he had been a narcotic officer in California for 38 years. And he talked about how San Francisco Mayor London Breed was talking about the rising crime recently and wanting to refocusing on the law enforcement. But Ron Brooks believed that the opening of a safe injection site won't do the job, but would rather worsen the situation.
But safe injection sites, legal consumption sites, that's not the way we're going to end this. First of all, it's a misnomer. There is no safe way to host an injection site or a safe consumption site. You're dealing with substances that are illegal for a reason. It's because they're dangerous and they're addicting. It's because they attract crime.
And Michelle Hennessy, she's the president of Deputy District Attorney Association from the LA County, and she agreed from the law enforcement perspective.
The presence of injection centers attracts other illegal activity to the communities where these injection centers are located. And that means drug traffickers are going to show up near the injection sites. And you will have addicts, unfortunately, committing thefts to gain the resources to buy drugs and committing those thefts in the same area where they're going to use those drugs. And they also, unfortunately, sometimes will sell their bodies for sex to pay for drugs. And that's going to be happening in these same areas.
And Ron Brooks reviewed that in the United States, what's the situation? The last 12 months period, ending April 2021, the drug overdose death exceeded 100,000. 100,000.
Oh, 10 times.
Yeah, it's already underreported according to him because in a lot of community he said that they lack of resources to really assess those deaths. And what's the year before? It's 70,000, and the year before that was 68,000, and 65,000 the year before that.
Whoa! So dozens of times of jumping up.
Right.
Wow.
So. And he said it doesn't not even include people who died because of intoxicated drivers and related diseases. So strictly just from the overdose. And as an example, Ron Brooks, he compared Vancouver, Canada. He visited there because he said it's a similar city to San Francisco, great nature beauty, beautiful architectures. And they have implemented injection sites for 18 years.
Crime has gone through the roof. Drug overdose deaths have gone through the roof. Instead of lowering drug overdose deaths, they've increased about 1,000%. Look, one of the things that makes me most nervous about all of this is words matter, actions matter. And when we talk to people about safe injection sites, there's an implication that somehow it's acceptable to use these illegal and dangerous drugs. That somehow our young people get the idea that there is a safe way to accomplish this, and we simply know that that is not true.
So he talked about Canadian experience, but what the Canadians say about that? So one of the speaker of the press at the press conference, Reverend Wayne Lowe, he's an executive director of Vancouver Chinese Christians for Social Concerns. He opened up saying that those people who support a safe injection site, touting that this is gonna solve the problem of a drug overdose. But he shared some data from British Columbia coroner's report on drug toxicity death. And let's show that. And you can see that in 2003, the death of overdose from the overdose drugs is about 190. That's 18 years ago. Now, 18 years later, after they implemented this safe injection site for 18 years, 2021, the death rose to 1,782, 10 times, almost 10 times. So, yeah, let's listen to his opinion.
Because that injection site has become a huge magnet drawing drug users, not only drug users, but also traffickers, drawing drug users from other areas in the province as well as other provinces of Canada.
So he really just said that the injection sites are useless in terms of controlling the overdose death, and just attracting more crimes, and as he said, attracting more homelessness because it attract people from other areas too. He said since the opening the site in downtown Vancouver, which is next to the east side of Chinatown, in Chinatown the burglaries soared up to the roof. That's his own words. And the shop owners, you cannot even get insurance after got hit twice, and finally had to just close the door after 2 years in 2005, and let alone the homeless problems. And well, he has a saying, he responded to some people saying, we have to be compassionate to those drug addicts.
So, if you say love your neighbors, give them drugs, oh no, that will be a very wrong way. Even though you have the right heart, you have a heart, you have a kind, compassionate heart, but you are doing the wrong thing. You are applying your compassion with the wrong methods, in the wrong direction.
And Michelle Hennessy, president of the Deputy District Attorneys Association in Los Angeles County, she had a different opinion about whether this is compassionate or not.
It is just not compassionate to expect people who are in the grip of addiction to decide on their own to stop using drugs when they can barely engage in basic self-care because of their addiction.
Yeah, so that's the Canadian experience. You may wonder, how about European? What's their experience? Another speaker at the press conference is Leonard Carlson. He's the president of Sweden Police Officers Association. Himself is a police officer. So he has a comment about such so-called safe injection sites.
I would say that it's not a solution, but it's more like an illusion of a solution.
Okay, why he said it's an illusion of solution. He said there's no evidence that it will, such site will lower the death from the drug overdose or would lower the crime. Actually, he said according to their data, in most of places with such sites, the death of overdose and crime are all higher than others. He gave an example about Portugal. He said it's very famous for successful drug policy. In 2021, Portugal decriminalized the drugs, and actually the death from the drugs decreased. But you can look at the chart. In 2018, when they introduced mobile injection bus, the death rise again. Actually, it only, it didn't really go to the current data, but he said, let's listen to him. Oh, actually, not this one. But what he just said, he said it was as of now, actually the death rate rising to reach where it was, back in 2000. So, and he explained why the decriminalization was successful back then. He said because they put massive resources to healthcare and the rehab facilities. So actually, they just not simply decriminalize the drugs. And he said the safe injection site had another problem it will create was that there will be a de facto legalization of all drugs and cripple the police and the law enforcement. Why? Because if the police try to intervene drug selling, and the drug seller usually they only have small amount of drugs with them, and then they would just say, give an excuse, oh, I'm going to the injection site. Okay, so he said this would really just cripple the law enforcement. So what is his advice to United States, to San Francisco, just based on the European experience?
So my advice for you, friends over in the United States of America in general and California, is to put your money to something that works. And that is law enforcement and treatment, because those things work. Drug injection sites does not work. And that's the European experience.
Okay, so actually, in California legislature, there's at least one assemblyman called Jim Cooper. He is a Democrat, but he also agreed that SB 57, the implement of a safe injection site, is not the solution.
And think about what's going on in our world right now in California. We've got floods, we've got fires, we've got COVID going on, and the overdoses are up dramatically. No one talks about it anymore. The fentanyl overdoses, the heroin overdoses, because that's kind of got sucked, all the air has been sucked out of the room, so we're still dealing with it. That's still an issue with it. If you've been in San Francisco lately, it's just horrific what has happened in San Francisco. And you're finally seeing the public start to turn against it and say, hey, you know what? Enough is enough. And I think we need to send the message here, enough is enough. We want to help these folks and get them off drugs. That's the number one thing. This is not the way to do it. We need more treatment programs with this.
It seems like, people all agree with that the treatment is really important, including Ron Brooks, the executive director of the National Narcotic Officers Association Coalition. He also mentioned there used to be drug courts, back in the war on drugs, and he said it's very effective. He mentioned some things very interesting. He said in the 1960s, where he grew up, Vietnam, because of the Vietnamese War, it took 58,000 American lives, and plus hundreds and thousands
there were protests in the street.
There were hundreds of thousands of more Vietnamese people died. However, let's listen to it.
And there were protests in the street every day. And yet we lose 100,000 Americans this year, and there isn't a single protest.
Yeah, so he, raised this question. So finally, the another speaker of the event, Frank Lee, he's the president of Organization for Justice and Equity, also with the Equality. Thank you. And he also was with the California Coalition Against Drugs. Actually, he's one of the Chinese Americans who's really put a lot of effort trying to organize communities to defeat such drug-related bills. And they actually together they wrote two letters, one to the Department of Justice and the Biden administration, urging them to really enforce the federal law related to the drugs. And they also wrote a letter to San Francisco Mayor London Breed, and he really called for the federal government to step in.
U.S. citizens should strongly urge U.S. Department of Justice under Attorney General Garland to enforce the law in the United States imperatively. They should understand that they are not supposed to create the law, but enforce the law. They would fail their job big time if they don't do that. It is definitely not sagacious for the Biden administration to give the green light to this virtual legalization of all drugs amid the upcoming midterm election in 2022.
So now, because actually California is trying to create its own law to for such a safe injection site, but according to the DEA Association's president from Los Angeles, she gives listed how it actually conflicts with the federal law, because there are federal laws saying that if you provide places for illegal drug injection, actually it's really like a felony. It can put it into years in the prison and up to $500,000 of fine. So people in San Francisco, in California, if this law is passed and people who work in such a safe injection site, basically according to the current federal law, they are violating that. So, but I think the coalitions, they are concerned that the federal agencies might moving towards legalizing those type of sites. So that's why they put forward those letters to urge the federal government to intervene. So so how do you think? This is pretty special to San Francisco, but actually since last year, San Francisco also grabbed like Los Angeles and Oakland, trying to join force to open up those type of safe injection sites.
Yep, as you may have taken note of the thumbnail, okay, the picture, the word we put there, we said put out a fire with firewood. This is a Chinese saying, Chinese idiom, okay, that's a stupid thing that you do, but that's something that we are doing in this country. It's pretty hard to believe, okay? So, but as you see, you have a very good wish. Well, I don't know, maybe it's just a veiled wish. But behind it, after you put it into use, you find out more, you discover more. I thought we were gonna learn from it, and I won't do it again. But apparently no, the agenda is being pushed and pushed and pushed. Okay, so let's quickly switch over to the next topic. How about that? So, okay, first, now CDC changes position on Omicron by quite a bit now, okay? And it's quite significant because if you stay with our program just in the last couple of weeks, and Kathy interviewed a doctor, whose name we cannot quite say it here, but just after a little bit, let's go to Safe Chat and we can talk about that because this doctor was just canceled. Okay, he was banned from Twitter today, which is a piece of news that we're gonna talk about after we move over to the Safe Chat. Anyway, so he gave us enough knowledge, which we only read now from the following news that I'm gonna read it to you. Okay, CDC changes position on Omicron by quite a bit. What does it mean? First, the CDC guessed the Omicron variant accounted for 73% of all cases during the week ending December 18th. But yesterday, they revised it. They said the number was not 73%, but it's only 23%. This is a massive reduction from the previous number. Why? The CDC said the discrepancy was due to a miscalculation of the Omicron transmission rate. But there's no specific reason, and the CDC merely said we have more data coming in, and from that time frame, and now there's a reduced proportion of Omicron. And the former Food and Drug Administration Commissioner, FDA Commissioner, Scott Gottlieb, commented on the CDC inaccuracy on Tuesday and suggested many of the hospitalizations previously attributed to Omicron could be a result of the Delta variant. Also, CDC, in the reversal of the previous recommendation, cut the number of days of isolation for Americans who contracted COVID-19 from 10 days to 5 days, regardless of the vaccination status. This received a lot of criticism from mainstream media like New York Times, Washington Post, and Los Angeles Times. The LA Times posted an Associated Press report on its homepage and retitled it to be CDC Move to Shorten COVID Isolation Caused Confusion and Doubt. Well, probably can tell it's the Los Angeles Times doubt. And regarding the hospitalization, according to a recent analysis of the CDC data, Even though number of Omicron cases surpassed that of COVID-19, the hospitalization rate for the Omicron appears to be far lower than previous strains. Okay, what are the numbers? Around 64,000 Americans were hospitalized with COVID-19 on Christmas Day, or December 25th. The previous record is September 1. And at that time, that was amid the Delta surge, some 98,000 people were hospitalized around the United States compared to today's 64,000. The previous peak is January 14th, when the COVID-19 virus is running high. 133,000 were hospitalized. So now we see cases more than the Delta time, but hospitalization is much lower. Actually, if I ask Kathy, does that sound, you would say, I knew it, right?
Yeah.
Okay.
Actually, yeah, we can talk about that
Yeah.
later on Safe Chat about that.
Yeah, the big talking point now, which I cannot quite highlight too much, is we knew it, okay, before CDC. We don't have to go through those data. And why? Why did we know that? Okay, so what to do now? The expert or the government official seems to be uncertain or wavering. Okay.
Well, talking about that,
Yeah.
we talk. Let's talk about another expert, and the famous expert, Dr. Anthony Fauci, President's lead COVID-19 advisor. Actually, he just recently on Monday sent mixed signals about whether a domestic air travel mandate would be implemented. As MSNBC, he said, I quote, "I think it's reasonable to consider." Yet, on the same day, he told CNN, I quote, "I doubt if we are going to see something like that in the reasonably foreseeable future." So what does CDC's opinion? CDC Director Rochelle Walensky was asked about Dr. Fauci's recent remarks regarding a potential, vaccine mandate for the domestic flights, and she replied in a very vague way. We consider all policies, potential in policy, and she said what we are talking about is ways to get people vaccinated. So that's the purpose. She admitted such a requirement has been a topic of conversation, but adding it's not something we are going to revisit right now.
Yeah, regarding the Omicron, and she said the CDC director said not all of those cases are going to be severe. In fact, many are going to be asymptomatic. We want to make sure that there's a mechanism by which we can safely continue to keep society functioning while following the science. So basically, the reporters asked them very clear question. Will there be vaccine mandate for the domestic flight? They're going to say this or that or this. You can tell they cannot give a certain answer.
Yeah, but I think if just reading between the lines, she actually just revealed that the purpose is really just to get people vaccinated. Mm-hmm. That's the bottom line.
Yeah. All right. So with all this, actually, 2 weeks ago, we already knew this. If you are our audience and you watch us every day, you already know this, right? We knew this before all this CDC data and before the news that I just read it to you. And why did we know that? Let's move over to the Safe Chat. Okay, we're going to talk about some topic that we cannot quite talk about here. So for our, back-end staff, please post the Safe Chat link over there, and we're going to go over there and continue the next discussion, which I think is very short, okay, but it's very important.
Okay, shall we and just address some of the comments here?
Right.
First,
yeah. Sure.
Yeah.
How do we grow your channel? This Mark Sommer said. Yeah, thank you. That's really a question also on top of our mind. We're thinking that over.
If you have suggestions, we would love to hear from you.
Yeah, for now, of course, just share and click likes. And okay, also just move over to the Safe Chat, and we're going to discuss your question there too. Okay, so how about that? Let's go over there.